Hi, I'm Stephanie, the PT, and with Nicole, the OT, we make up the Note Ninjas. We teach PTs, OTs, and assistants treatment ideas and documentation tips. So today, we want to talk about bed mobility. So if you are a home health therapist or Part B therapist that goes to the home, it's very easy to go into your patient's house and check out their setup. And we should be doing this. We need to take advantage of those opportunities to see actually how they move in their natural environment. But if you're in an outpatient clinic, you should also do the same. Make sure you're asking your patient about their bed, about if it's against the wall or if it's in the middle of the room. Can they get on from either side, or is there something in the way of it? Um, Maybe the sheets. How heavy are the sheets? We want to make sure they can move and not be a fall risk. And then we should work on these things. If they have to get on the bed from the right side, make sure you're working on it from the right side of a bed or from a table if you're doing this in the clinic. Make sure if they have an issue with one of their shoulders that they're getting in from the opposite side and they don't have to necessarily roll onto that bad shoulder. Make sure you are talking about different kinds of techniques. If they're able to roll, maybe they can't roll because of an issue. Maybe they can't because of a hip. Just make sure you're giving them lots of different cues and different ideas to do it. If their bed is high and they can't go buy a new bed, maybe they do need a small stool, maybe one with like a railing, or they could put a railing on the wall to help them with safety. We can't always change things. We would love to have everybody's house set up perfectly with the right safety things, but it's not always possible. So we need to ask these questions and set up the safest way for our patient. And plus, we also have different issues. They might be coming to you for a fall risk, but yet they've had a shoulder injury forever. And we have to ask them. We have to know because that's going to affect the way they do their bed mobility and really everything else they do in life. And then just make sure to document it. Document what your patient has, this injury or this weakness or this setup, and what you did about it. What kind of cues you gave them, what kind of education you gave them on the best way to do things so they don't fall. Make sure to write that down. It's all skilled and it helps your patients really live their life to the fullest. So for more treatment ideas and documentation tips, make sure to follow us at the Note Ninjas.